Okay, now we'll proceed further. Yesterday we did two preventive strategies, that is engineering measures and personal protective measures. Today only few students of final prof part 1 met me and we realized that the examinations are not far away. Actually probably the send-ups will start even within a period of about 1.5 to 2 months. So we do have to move fast because we must finish our syllabus by before the about 7-10 days before the start of send-ups. So I will be moving now fast, explaining concepts, and rest reading you have to do from your book or from your notes, and if you want to use my notes you are most welcome. So today we will do the medical measures. Today because I am not yet fully prepared, so today I will only do medical measures, and then next time I will finish off with legislation and probably another one more talk, and we will finish off with occupational health. So medical measures are important because if somebody has to ask in detail or if somebody has to give you as a note, examiner will not ask us engineering measures as a separate note, but medical measures because it is our concern directly. So remember, they are very simple. Pre-placement. So once we have to do examination, before we place, we give him a job, and then we have to do periodic medical examination. So two are related with each other. And thirdly, we have to provide him health services. So what comprehensive health services? Whenever we have to provide services, we provide comprehensive health services. Then next will be health education. Health education and counseling, the book says. Then there are 2-3 things, that is notification, record keeping again, and environmental surveys or inspection. These are the 5-6 headings. We have to understand this. I am not going into detail. I am not going to teach you. I will just explain. Pre-placement is placement, a medical examination done before the employment is given. Or basically, placement means before we have given him the employment, but we want to place him. So we have to examine him. So normally this can come as a 5 marks note in university examination. It has been asked as a pre-placement examination. Pre-placement examination definition we have understood. The aims are two. Firstly, we get the baseline data, and secondly, we want to place the person so that the job does not do any harm to him. And thirdly, we can make one more point to score better. He doesn't do harm to others. We can give an example. If I am anemic and I am placed in a job where I am exposed to lead causes anemia, so it will cause harm to me. If I am colorblind and I am placed given a job as a driver, I will hit into somebody or cross the red lights and cause accidents, so I will cause harm to others. So we have to give what are the aims and objectives of this thing, and then we have enough to write that how it will be done. We will take detailed history, and because we have to score better marks, so we will say we will take present history and past history and drug history and treatment history and family history and occupational history. We can write this thing. Then we will do complete examination, and because we have to fill few pages, so we will write general physical examination from head to toe, and systemic examination we will do. And then we will do investigations. Investigations will depend upon what we can do, what are the resources available. So normally we do hemoglobin TLC and complete blood picture. We will do urine, we may do blood sugar, we may do X-ray of chest, we may do an ECG, liver function test and renal function test. That is good enough. And then I have added into my notes what are the challenges in this thing, so that what is the problems in pre-medical examination, and that is when the person is coming for a job. I do not give the person my exact history. I will not tell that I have been taking drugs. Why should I tell? So these type of problems are there. So pre-placement examination we should be able to write note, and then we have to give examples. Like if I am suffering from anemia, I will be not exposed to lead. If I am suffering from chest problems, I will not be exposed to silica. If I am suffering from some liver disease, I will not be exposed to dyes. So if I am suffering from some again blood disease, anemia, or some cancer, I am predisposed to precancerous lesions are there, then I will not exposed to ionization radiations. So these type of few examples we can do. Periodic medical examination is repeated medical examination. Normally we should do it once a year. But in some, if the exposure is risky, the exposure is to metals like mercury or lead, the book says we should do it monthly. And if a person is exposed to dichromates, then it has to be done daily. This question has been asked in NEET. So daily medical examination for dichromate exposure, the medical examination has to be done on a daily basis. Comprehensive health services, when we are employing him, we will provide it comprehensive health services, which basically means promotive, preventive, curative and even rehabilitative services. Health education we have to provide. We have to tell him that do not smoke. Let us say proper nutrition is one thing. Then we will advise not to smoke, keep good personal hygiene, to use personal protective measures. So these are the normal basic health education services we will provide. Notification, there are laws which will come to factory laws, acts are there, in which we have to notify diseases. For example, silicosis, we have to notify. So there are under the Factory Act, there are 29 diseases. Under the Mines Act, there are 3 diseases. And under the Dockyards Act. So these are the diseases we have to inform, notification. Then we have to maintain record. So I have been examined periodically. So and I fall sick. So there will be a record kept. And finally, environmental surveys. Environmental surveys were also being done by the engineering methods. So they were monitoring the chemicals in the atmosphere. We will, as a doctor, we will monitor the general atmosphere, environment. If I go for a factory, I look for the water supply is safe, the sewage disposal is safe, enough number of urinals and latrines are available to them. The ventilation is as per law. There is, machines are being safeguarded. People are using protective measures. So that this will be my doctor's inspection surveys. So I will stop here. Next time I will take up the legislation part, that is the Factory Act and Employee State Insurance Act. These I will do very fast because I will just introduce the subject, and because you have to read, there is not much understanding there. Medicine we have to cram and remember. We can't help it. It is not physics or mathematics. Thank you.